Coronavirus disease COVID-19 is now a pandemic ravaging the world and its economy. African countries are experiencing a rise in the number of new cases of COVID-19 coronavirus. World Health Organization (WHO) declared that COVID-19 is now a pandemic to all countries. Government of Nigeria is responding in line with the provision of pandemic policies as enshrined in the 1999 Constitution. The country is engaged in massive awareness creation, border surveillance, and lockdown supported by stay-at-home campaign, as well as provision of testing and isolation centers for quarantining and treatment within the limited capacity of the country's health management system. The federal government has made provision for special grant to the homegrown school feeding program for children at home within their communities. The Almajiris, who constitute 9.5 million UNICEF 2014 of the country's population, mostly children within the ages of 3 to 14, are left out and far from benefiting from these palliative response mechanisms. The Almajiris are citizens that depend on door-to-door begging for survival, and the lockdown may render them to starvation. Poor access to information and opportunity of parental guidance on the COVID-19 denies them from observing social distances and access to medical services. Almajiris are mostly vulnerable to come in contact with infected persons as beggars, who take whatever comes to them as food or support and could serve as potential carriers. Advocates for the rights of Almajiris, a forum of NGOs in Nigeria, calls on federal and sub-national governments to, as a matter of urgency, identify and include the Almajiris and street children in the COVID-19 response mechanism. Provision of relief packages, food and non-food items within strategic locations for the Almajiris. Provision of temporary shelter to protect the children from contracting the virus while ensuring access to food and safety within recommended distances. Proper safety and protection of children on transit must be ensured in line with child protection and safeguarding principles. Provision of temporary camps pending when parents identify and take custody of their children. Provision of adequate protection items, including sanitizers and face masks for the children and caregivers while on transit. States should embark on fumigation exercise. They should take into cognizance that some children sleep under the bridges and inside dry culverts and waterways. Therefore, proper checks should be done before commencement of the exercise. State and local governments are to ensure exclusive mobilization and support for all citizens, to include Sangaya centers within the local government areas. Almajiris are citizens of Nigeria who also have legitimate rights to social services and protection in line with the Convention of the Rights of Children that Nigeria and all other countries have signed and ratified. Action Aid Nigeria is a global movement of people working together to further human rights for all and defeat poverty, has called on the federal government to track and monitor the utilization of resources committed to COVID-19. Action Aid Local Rights Program, LRP, will continue to promote and advocate for local governance autonomy and promote child protection at local and state level. Action Aid advocates for the rights of Almajiris. Government should act now.